Anybody know what is the most common cause of death in women in this world?
Heart, isn't it? Heart attack.
Anybody else has any other opinion?
Heart disease?
Well, basically the same thing. Actually, more women die from heart disease than the next 11 causes combined.
Oh my goodness.
I'm sure you did not know that.
No.
Add up all the other one, colon cancer, breast cancer, cervical cancer, all of them added together, still don't come up to the number of women die from heart disease. So a lot of people think that women don't have as much heart disease as men. This is a very common myth. Mm-hmm. It's a real myth. The other point that is uncomfortable for people to know, particularly men, is did you know that men who have erectile dysfunction, if you put them on a treadmill, 90% of them will have abnormal results. In fact, within 5 years, most of them would have ended up with a heart attack. In other words,
What's the correlation?
like one of my colleagues used to say in his presentation, he says, you know, these men don't realize the penis has been warning them for 5 years before they were going to have a heart attack. Because you see what happens is that arteries in the penis are very tiny. So when you have a problem with the blood vessel, the smallest blood vessel get affected the most. Okay? And so it is like a canary in a coal mine. It says, hey, there is a disease going on in all the blood vessels, so watch out. That's really the message. This is why we put them on a treadmill. 90% of them will have abnormal results. So all men in your lives, your husbands, your boyfriends, your sons, if they have erectile dysfunction, they should have a stress test. Stress test. Heart, stress test for the heart. And this is very important. And so basically when you're treating the erectile dysfunction, you're treating the symptoms, not you're treating the cause. Like I had a gentleman that came to me from Fargo because I heard that a lot of people may not know me. I'm board certified in internal medicine, general cardiology, interventional cardiology, and forensic medicine. However, I also strongly promote preventive health and natural healing. I don't believe in giving you all kinds of herbs to make it all go away. I only recommend herbs that have been proven in clinical studies to improve health. For example, there is a berry that's grown in India. If you eat one of those berries, it'll drop your cholesterol by 40% in 6 weeks. There are 2 studies published, no, about 4 or 5 studies published in the medical literature showing that these berries lower cholesterol. So I recommend natural healing, if at all possible. I'm a board certified cardiologist, but I do procedures. I put a pacemaker in today. That is what I call a backup option. In other words, if your natural health principles don't work out, then I come up and say, I can do something more for you. You had a question.
What's the berry?
I'm sorry?
What's the berry that you recommend?
Oh, anybody know what it is? It's called the Asian Indian gooseberry. It's called AMLA, A-M-L-A. You cannot buy the fresh fruit in the US because of import restrictions. You know, plants are not allowed to be brought into the country. But you can buy the powder. The berries are, you know, they remove the pit, they dry it and powder it. I can tell you, I've tasted both, the berries and the powder. The powder tastes like a mixture of sand and sawdust. But you know, it only takes 1 teaspoon. You put it in, say, V8 juice or tomato juice, gulp it down, and you're okay.
So why don't the pharmaceutical companies use it?
Because they can't patent it.
Oh, okay.
You cannot patent broccoli.
But we can't, we got.
So you cannot, for example, there is a spice called turmeric, okay? You cannot patent turmeric. So what they came up with is they thought, we'll find out what is in turmeric and make a lot of it. And they found out it's called curcumin. Curcumin or curcumin, that's an active ingredient in turmeric. But we know that turmeric outperforms curcumin. Why? Because you see, we think that here's the problem. Curcumin can be patented, but you cannot patent turmeric. For example, I'll give you another example. Long time ago, people realized, like 50 years ago, that people who ate a lot of dark greens, carrots, they lived longer. They had fewer cancers. So the scientists said, hey, we'll figure it out. We cannot patent kale and spinach, right? So they try to find out what is in the green leafies. They found that they all had lots of vitamin A. So they did a study. They took volunteers, two groups. One got vitamin A supplements, and the other one got placebo. The people who took vitamin A supplements died sooner. Okay? Second example, we noticed that people who ate a lot of nuts and seeds lived longer, they had fewer heart attacks. So the scientists said, we cannot patent, pecan nuts, so what we're going to find out what's in the nuts. They found that all nuts had lots of vitamin E. So we did a study, I was part of the study. We took volunteers, gave them vitamin E supplements against placebo. The patients who took vitamin E supplements died sooner. What's the moral of the story? Huh? Pills don't work, plants work. Third example. You see, they found that tomatoes, that red pigment of the tomatoes, called lycopene. Tomatoes, people who eat a lot of tomatoes tend to have fewer prostate cancer. It seems to suppress prostate cancer growth. So scientists said, does it work if you just give them cooked tomatoes? Actually, cooked tomatoes works even better because it releases more of the lycopene. Then they said, what about pasta sauce? Pasta sauce worked splendidly because that's basically tomatoes, right? Then some scientists came out and said, you cannot patent tomatoes. So they thought they can take the extract of the red pigment called lycopene. They made a concentrated form of lycopene, fed it to volunteers, and the men's prostate cancer started to spread faster. So what's the moral of the story? Pills don't work, plants work, okay? You got to eat the whole plant. There is a reason for it, because if you consume, say, broccoli, you're not only getting one particular chemical, you're getting maybe 3,000 other beneficial chemicals. They all work together like an orchestra to give you the benefit. So don't take supplements. Vitamin E supplements do not work. It increases mortality, death rate. Vitamin A supplements do not work. Okay? Vitamin C supplement is good for you, except there is no need for you to take more than like 200-300 milligrams a day. If you take more than 300-400 milligrams a day, you'll have the most expensive urine in the town. Goes out of the toilet bowl, okay? So you're wasting your money. However, vitamin D is extremely important. Everybody should take vitamin D supplements, D as in David. There was a fascinating study that came out of Hawaii. You know, Hawaii, these young fellas are walking around nearly naked doing, surfing, windsurfing, right? They're hardly wearing any clothes. They checked the vitamin D level in those people. Tropical part of the country, they're in the sun all day long. They did not have enough vitamin D in the bloodstream. In fact, one Mayo a professor who gave a talk. He said, vitamin D deficiency is a pandemic. You know what that pandemic is? It's just worldwide. So everybody should take vitamin D supplements. But here's the deal. Vitamin D works better when you also take vitamin C supplement. In the presence of magnesium and vitamin C, vitamin D works better. So make sure you take magnesium supplements. By the way, which form of magnesium is the most effective? Anybody know? Glycinate. Magnesium glycinate is the most effective supplement. So you should take magnesium supplement about 500 milligrams a day, and again 500 milligrams of vitamin C. Now you'll say, Dr. Chelliah, you're contradicting yourself. You thought only about 100 or 200 milligrams of vitamin C is needed. Here's the deal. If you take 50 milligrams of vitamin C by mouth, 50 gets into your bloodstream. If you take 100, 100 gets into your bloodstream. If you take 200, 200 gets into your bloodstream. If you get 300, 200 gets into your bloodstream. If you take 400, okay, maybe 201 milligram. In other words, beyond 200, you don't get a lot of benefit. So why do I recommend 500? Just to make sure individual variation may be there. So it makes sense to take a bit more, but it doesn't make any sense to give 2,000, 5,000 milligrams of vitamin C. Doesn't work. Any question? I'd prefer to answer questions.
Megan, how much vitamin D did you say?
Okay, the usual recommendation is 2,000 international units, but I was taking 2,000 international units and I eat healthy food. I checked my vitamin D. It was so low I couldn't believe it. I kicked up my dose to about 5,000 units a day. So I think that individual may vary in terms of how much they get into it. So I would recommend about 5,000 units a day. You cannot overdose on 5,000, but you can definitely overdose on 20,000 units. So you don't want to get into high dose of vitamin D, but about 5,000 is reasonable. Yes, go ahead.
How much magnesium?
About 500 milligrams a day. Glycinate. Any other questions? Yes.
In addition to some of the vitamins, what about overall diet?
Overall diet. Studies are shown, I was saying this, I did a show this morning on the radio, and I said that our diet is pathetic. American diet is terrible. Okay? I think that your diet should, everybody, I mentioned this morning on my show, the people who live the longest in the world are all people who consume beans. Beans. Now, here are some interesting points. There was a study published about 15 years ago. Women who had one breast removed for breast cancer, they followed them for the next 5 years. They found that the women who ate a lot of beans, including soybeans, I'll come to it in a minute, some people think it's controversial. Women who ate a lot of beans, including soybeans, 90% of them were alive at the end of 5 years. Whereas the women who had the one breast removed for breast cancer, over the next 5 years, they did not eat beans. Less than 50% of them were alive at the end of 5 years. See the difference? Huge difference.
What kind of beans? Like just
Well,
or?
this is a very common question I'm asked. I am smiling because you know what I tell them? How much good will the beans do that are sitting in your pantry? You have the best beans in the world sitting in your pantry because you don't like the taste of it. How much good is it going to do? Like my late brother once told me, he said, Noah, I made some good food for him. He says, well, before this good food does me any good, it has to get past my lips first. Okay, so what I would say is all beans are good. So the beans that are best for you, the one that you like. There's no point eating beans that you don't like simply because it's got health benefits. Because all beans are good. Some beans are better than others, but all beans are good. So eat the beans you like. If you like pinto beans, eat that. If you like black beans, eat that. Don't say, well, one bean is better, so I'm going to try to eat that even though I don't like it. It doesn't make any sense. By the way, beans should be cooked without sugar, molasses, or meat. Pork and beans will not do it. You know what? Any dietitians here, I don't want to offend anybody. No, okay. Most dietitians will tell diabetics, don't eat beans. That is the worst advice you can give to the patient with diabetes. Beans improve diabetic control. The only problem with the beans is the way we make it in the US, we dump a lot of sugar or molasses into it, or add meat to it. Then it doesn't work because there's so much sugar, it defeats the purpose. Beans, in my opinion, are the God's best gift to man. It has lots of protein. It has lots of fiber. It has a lot of carbohydrates. But because it's balanced with fiber, it has protein. By the way, you heard of soybean oil, right? So beans contain some oil. So it has fat, protein, carbohydrate, fiber. What more do you want in your food? So everybody should be eating beans. Women should be particularly eating broccoli on a daily basis or 3-4 times a week. And women should be consuming cooked mushrooms several times a week. You don't like mushrooms?
I like them on pizza, but not to just be.
Studies,
or in a dip, and then there were.
studies have shown that there is a chemical in mushrooms that blocks the conversion of, let me back up. You see, breast cancer loves estrogens. Not all of them, but many of them love estrogens. They thrive on estrogens, and they thrive on cholesterol too. So when the breast cancer runs out of estrogen to use in women, it does something very tricky. Women and men both have androgens. You know that, right? Women have more estrogen than androgens. Men have more androgens than male hormones and female hormones, right? We all have that. So what happens is it goes and looks for, because it ran out of estrogen, it goes for a male hormone. It says, hey, I can use an enzyme to convert the testosterone into estrogen. Okay? There is a chemical in mushroom that specifically blocks that enzyme. So it actually starves the breast cancer cells from growing, using the testosterone to convert it into estrogen and use it. This is why mushrooms should be consumed by every woman. However, it should never be consumed in a salad bar. Why?
You know what?
Do not eat mushrooms in the salad bar. Why?
Why?
They are not cooked. Raw mushrooms has a poison in it called agritine. So you don't want to eat raw mushrooms. It should be always cooked. It doesn't take much. You only have to cook it just for a minute. Like you throw it in the microwave oven for 2 minutes, and the agritine is gone. Okay?
Not just fresh mushrooms.
Huh?
Not the canned mushroom stuff.
Any kind of mushroom, just cook it. Cook it, steam it, saute it, do something with it, but at least apply some heat. Okay? And do you know which is the most contaminated animal product in the world right now?
Cheese? Milk?
Huh?
Milk?
Nope, not yet. Fish is the most contaminated animal product in the world. There are lots of studies show that fish consumption increases the risk of cancer, diabetes. In fact, there's one study that I came across showed that people who eat fish on a daily basis had a 35% increased risk of developing diabetes for the first time in their lives.
Is that worldwide or just the States? Just United States or worldwide?
all over the world.
Even Japan, where they?
All over the world. They caught some fish in North Pole, and it showed contaminants, industrial toxins. Fish itself is, I'm a born-again Christian, so some people ask me, what, Jesus served fish? I said, yeah, when Jesus served fish, I'm sorry if I'm finding anybody, 3M wasn't dumping lots of chemicals into the lake fish is just as bad. You heard of that story, right? 3M dumped a lot of chemicals. Those chemicals are extremely toxic. The PFAS chemicals, those are extremely toxic. So fish consumption is one of the worst things you can do right now. There is something else that happens to fish that doesn't happen to grain. Have you ever heard of a wheat plant eating another wheat plant? A rice plant eats other rice plants? Well, what happened to the fish? The big fish eat the small fish. So what happens is if you start out with a whole bunch of fish, each of the small fish accumulates some toxins, right? The big fish has already accumulated a lot of toxins by floating in there for a while now. It eats all the small fish. Now it has the same toxin that it developed on its own, plus all the toxins from the small fish. This is called biological amplification. This is another reason why fish is extremely toxic. The worst fish for toxin is salmon and tuna.
My two favorites.
It is coming from somebody who love to eat fish. I ate a lot of fish. My favorite fish were like walleye, trout.
Yeah.
I gave a salmon. I gave it all up when I started reading all this, and I said, this is no good. By the way, a lot of people know that I also recommend against all animal products, including beef. I have a long 1-hour lecture. I don't have time to go into it right now. But all animal products contain a chemical called IGF-1, insulin-like growth factor number 1. It is highly, let me back up. I'm not into animal husbandry, but I've been told that people who raise cattle, they say the cat, when the calf born, it doubles its weight in 6 weeks. Is that true? Anybody know this? Calf, when it's born, within 6 weeks, it's doubled its weight. What does it consume for the first 6 weeks? Milk. What is in the milk that doubles its weight in 6 weeks?
Grains, I suppose.
Huh?
Grains, I suppose, for
No,
waiting?
milk.
Oh,
It drinks mother's milk, right? Cow's milk is drinking. What is in the cow's milk that makes the calf double its weight in 6 weeks?
Cholesterol.
No, it's called IGF-1, insulin-like growth factor number 1. And that is the one that makes all cells grow. So when you consume beef, which contains lots of IGF-1, what do you think your cancer cells do? Cancer cells, the IGF-1 does not discriminate against normal cells and cancer cells. It makes all the cells grow and multiply. So this is why all animal products actually worsen cancer risk. There is another problem. There was a Swedish scientist who did a fascinating study about 50, 70 years ago. He took horse meat, raw horse meat, fed it to the laboratory animals. Nothing happened. He roasted the meat and fed it to the same rats, and they developed cancer. So he said, what's going on here? Raw meat didn't do it, roasted meat caused it. Then, in the last 20 years, other scientists figured it out. They found that when any meat, any muscle, whether it be fish, chicken, pork, beef, when it's subjected to any kind of heat, roasting, boiling, frying, microwaving, it converts about 17 different chemicals called heterocyclic amines. Every one of them causes cancer. Now, this advice is coming from somebody. How many of you know which is the largest steak available around? Size? Have you heard of the porterhouse steak? 32 ounces.
Wonderful.
Did you know? Yes, I agree. That's why I ate it about 25 years ago. Ate a porterhouse steak all by myself. So don't tell me, Dr. Chelliah, you're telling us not to eat meat because you hate meat. No, I don't. I love meat. I gave it up because of science. Okay?
So do you just eat beans
Yes.
and broccoli?
No. Yes. No pain. No aches. I'm doing great. I'm much older than some of you. The other interesting thing is these Asian spices are extremely beneficial. Not all, but many of them. Like turmeric contains, it actually improves arthritis pain, dramatically improves arthritis, reduces inflammation.
What does?
Turmeric. Okay? Ginger is good for you, garlic is good for you. By the way, those of you, I know there are older women and younger women who still have menstrual periods, you should be consuming ginger on a daily basis. Why? Daily consumption of ginger dramatically reduces PMS and it lowers the menstrual blood loss by 50%. It is all natural. You don't need to go buy ginger pills. Just peel the ginger, throw it in hot water, boil it, make tea out of it, drink it. Or if you take ginger powder, take a small amount. All you need is 1/8 of a teaspoon. That's the trick. It is good for nausea, all causes. Cancer-induced nausea, pregnancy-induced nausea. In fact, ginger is extremely safe for pregnant women. Okay? Garlic is good for you, but don't eat raw garlic. It's antisocial behavior. But then you cook the garlic, you lose some potency. Okay? There's a trick that you can do that gets you the proper benefit. What you do is you crush the garlic, let it sit on the kitchen counter for 15 minutes before you chop it up and use it. Then you cook it lightly, you get all the benefits of garlic without the nasty smell. Okay? Garlic is good for you, ginger is good for you, turmeric is good for you. So I have a complete presentation on Asian spices, how they can enhance your life. You should, by the way, there are a couple of YouTube videos I have if you put my name on the YouTube, search it. I did 2 presentations in Akron, Ohio. They are on YouTube. They are long, but you can watch it. I talk about all this. Broccoli is good for you, kale, spinach. And by the way, any of you do preservation for eye health? The supplements? Eye health supplements? Did you know that there are some chemicals in that which actually work? But did you know that in order to get the same amount of that chemical from eggs, you have to eat about 40 eggs a day?
Yeah.
But the same amount of that chemical is in 1 tablespoon of kale.
What? Kale?
By the way, kale is better than spinach because spinach has more oxalic acid.
How do you get your throat to get the kale down?
I have a few tricks. First of all, if you cook it with, I cook the kale.
With what?
With onions. Onions actually mask the bitter taste of green leaves. Okay. Also, it is the same thing with spinach. Then another trick, I use lentils. There's a special lentil that's imported from India called pigeon peas. You can get it in the store here, but it's more expensive. Pigeon peas, I cook it with pigeon peas, split skinless pigeon peas, and it masks the flavor of that spinach, and it enhances the flavor because the pigeon peas has a tremendous flavor. It's one of the most popular,
What's the name?
pigeon peas.
How do you spell that?
Pigeon, you know what a pigeon, the bird, pigeon?
Pigeon?
Yeah, that's the name of the pea. It's called pigeon peas. Another traditional name is called tur dal, Toordal. Pigeon peas is the English name. It looks yellow like yellow split peas, but it's a special kind. There is no comparison between yellow split peas and pigeon peas. It's like comparing a Maserati to a Volkswagen Beetle. It's expensive. I pay $3 a pound, but it tastes awesome. By the way, if any of you make the mistake of coming to Grand Forks on a Saturday, come to my office and I serve a free meal every Saturday. I've been doing it for 10 years. I make all this. I make beans. I make lentils and spinach, and I serve like a coconut rice with all kinds of Asian spices, cinnamon, cloves, cardamom. How many of you know what cardamom is? Cardamom is one of the most beautiful, beneficial spices. After you eat a couple of cardamom pods, your white cells will kill twice as many bacteria and viruses. So I always ask people, how come you don't eat these spices?
Because they're not salt and pepper again.
And they're not.
Well, salt
not-
and pepper actually do more harm than good.
They're not usually cheap either.
Huh?
It's not usually cheap when you get all those.
Yeah, but the point is this, going to the emergency room is very expensive.
Yeah, true.
The last time somebody ended up there, it cost them $1,700. I think these spices are much less expensive. How many of you know about the most expensive spice in the world?
Oh, saffron?
Saffron. How many of you know anything about it? It is the most expensive spice in the world, and it has a tremendous benefit. There was a fascinating study published from Australia. Not Australia, Florida, University of Florida. They took saffron. It's a reddish string. What they do is they put it in water. It turns the water golden yellow, and it has a very pleasant smell. Very, very pleasant smell.
Beautiful with chicken.
What they did was they diluted it and diluted it and diluted until the solution looked like water, and the smell went away. Couldn't smell it. At least the people who did the experiment. They labeled it A and they labeled the water B, regular water. And the women with PMS symptoms, when they smelled this so-called saffron water, which didn't look like saffron, didn't taste like saffron, didn't smell like saffron, their PMS symptoms improved dramatically. So, question, why are you not using that saffron? By the way, yes, it's a very expensive spice, but it only takes about a quarter's worth of saffron to improve your health per day. Can't you afford a quarter? Particularly those of you who go and get these expensive coffees, designer coffees, $5, By the way, if your spouse is crabby, feed him or her some saffron. It improves the mood, attitude, dramatic improvement. In one study they went into nursing homes where the Alzheimer's patients were, and they gave them saffron. They found that saffron did as good as the Aricept, this is a conventional prescription medication with a lot of side effects. Saffron, no side effect. They got just as well. So why are we not using saffron? I told you, I believe in modern science, modern medicine, but I also believe in natural healing that is based on scientific proof. Any other questions? Yes, ma'am.
Say the vitamin was good
I'm
for-
sorry, ma'am?
What did you say the vitamin was? It works with arthritis?
Not vitamin, turmeric. Turmeric powder dramatically improves.
Potato powder?
By the way, same thing happens with capsaicin. You know what capsaicin is?
What is?
Capsaicin is sold for arthritis. Do you know where it comes from? Pepper. Chili peppers. Chili peppers, the official name is capsaicin.
Really?
Yeah. So instead of buying expensive capsaicin capsules, why don't you eat some more peppers? Yes, ma'am.
How about calcium related to heart disease?
It's a myth. We're running out of time, so I'm going to give short answers. Calcium worsens heart disease is a myth. It does not.
Okay, because there's a lot of heart issues in my family, and I was told by a doctor that I was taking too much calcium, or I shouldn't take much calcium because of the risk of a heart attack.
Unfortunately, he is wrong. Here's the deal, okay?
And it wasn't a local physician.
Well, let me give you the lowdown on this, okay? Do you know the average doctor, the average number of hours a doctor spends on learning about nutrition, human nutrition? In the whole 4 years medical school? 20 hours. You think you can learn much about nutrition in 20 hours? By the way, most doctors know nothing about human nutrition. I'll give you a couple of examples. How many of you have pets? I don't have any pets, but I've been told by some pet owners that one of the first questions the veterinarian asks you is, what do you feed your dog or a cat? Is that true? They want to know what you're feeding the dog. When was the last time your doctor asked you, what do you have for breakfast, lunch, or supper? I mean, explain that to me. How come your doctor doesn't ask you, he doesn't realize, or he or she doesn't realize what you eat has something to do with health?
Pets have better food choices than we do.
Huh?
The pets do. Go down here and get it.
Let's not go down that rabbit hole.
Pretty much. They take care of their.
You know what? Listen, I have some strong opinions on this. I don't want to get into it. You know what? People who don't have enough food to feed themselves or their children, they have 3 or 4 pets and they're feeding those pets. That doesn't make any sense to me. That's another discussion. Anyway, you had another question.
Do you still see women presenting with different symptoms than men with heart attacks?
Yes, women have slightly different symptoms. This is why it has been thought that women don't have as many heart problems as men. They have less obvious symptoms, but they do. I remember a lady who I was asked to see. I came this morning, and the family doctor asked me to see this patient because he said, I think she has stomach upset, but I just want to make sure. I went and talked to her for a minute, and the X-ray people came there to take her for a GI. I said, don't do that. I said, cancel that for now. I think this is heart. I took her down to the lab, did an angiogram on her, showed that she had severe blockages. All she complained was stomach upset. So this is one of the classical examples of how women don't have classical symptoms of crushing chest pain, sweating, and all that. They have other indirect symptoms. So that is why they are often misdiagnosed.
So what clued you in? Was it just the stomach upset, or were there?
This lady just had stomach upset. She thought she had, too much acid in the stomach. By the way, there's another problem too. Men and women who have burning in the chest, they think it's heartburn. Very often, did you know that if you give them nitroglycerin, it'll relieve it? So sometimes heart pain mimics heartburn, angina pain, and so they think that, it's acid reflux, but actually it is angina pain. Any other questions? Again, if you have any question, by the way, let me give you some stuff here. You can pass it around, sir. Take a card and pass it around. I do 5 shows a week. Every week I do 5 shows. I'm on 2 different radio stations, and you can listen. Like I did a show this morning, and I'm going to do a show at 5 o'clock in the evening. The 5 o'clock show is a 1-hour show, and I answer questions on health. And you can tune in from anywhere in the world. We stream it live, so you're welcome to listen. Any other questions? Yes, ma'am.
It's not related to heart disease, but what about the new things they're coming out with for Alzheimer's and Indian honey?
Indian honey doesn't work, but there are some new treatment options available right now. They are looking into it, and it shows tremendous amount of progress. There's a new treatment. They are thinking that it reduces the plaque. There's a special plaque that deposits in the brain. That's the main problem with Alzheimer's. By the way, did you know that there is a gene for Alzheimer's? Gene. If you get one gene from your parent, you have about a 3 times greater chance of developing Alzheimer's. If you have both genes, you have like 9 to 10 times greater chance of developing Alzheimer's. In the country of Nigeria, everyone has both genes. In the country of Nigeria, nobody has Alzheimer's. How do you explain that? Anybody?
Must be what they eat.
Thank you. That's called epigenetics. That means, yes, Alzheimer's is predominantly a disease of the Western world. Europe, America. The Africans, Asian countries have very low incidence of Alzheimer's because they eat a lot of grains and not as much high-fat food like we do. One final thing I want to tell you, 2 things I want to tell you before time gets away from us. There was a fascinating study we published 5 years ago, showed that they checked to see which area people lived in increased the risk of cancer. Particular relation to restaurants. Guess which restaurant who lived nearby had the highest amount of cancer risk? People who live near restaurants have increased risk of cancer. Which type of restaurant do you think had the highest correlation?
Something fast food? Something fast food?
Well, you're close, but not quite. I'll give you a clue, ethnic. Which ethnic restaurant was associated with the highest number?
Italian?
Huh?
Italian?
Nope.
Hispanic?
Chinese. Anybody can guess why Chinese food, the fumes that are coming out of the Chinese restaurant increase cancer risk. Do you know why? They use high heat cooking.
They what?
High heat, wok cooking, very high temperatures. So based on that, can tell me the next one that highest amount of cancer risk? Come on, you can guess. Which other restaurant use high heat? Clue, grilling, steakhouses. So you want to live far away from Chinese restaurants and steakhouses. By the way, you heard these people say, your mother cooked bacon, and you say, when you wake up, you say, oh, that smell of bacon smells awfully good. That causes cancer. The bacon smell contains cancer-producing chemicals.
Oh,
So does the grilling. When you grill, so if you go to a church picnic, don't play frisbee next to the grilling station. Go away from there. Final point, I want to throw something at you and think about it. I won't give you the answer. Do you know the women who are blind have fewer cancers than women with full eyesight?
say that again.
Women who have no eyesight. Blind women,
Oh, okay.
fewer cancers than women with full eyesight. Now, I don't want you to go and pluck your eyes out saying I want to have less cancer.
Help me.
Because, I'll give you the answer because I don't want you to suffer for the next 2 weeks. You see, there's a gland in the back of your brain called the pineal gland. It produces a chemical called melatonin. Melatonin is one of the most powerful chemicals which kills cancer cells. Now, when there is any light shining in your eye, melatonin production is shut off at the brain. The pineal gland only produces melatonin when you have no light shining in your eye. This is why when your mother told you, go to sleep, get your rest, she was scientifically accurate. Because when you don't sleep enough, you don't have enough melatonin, especially if you sleep in a room with all the lights on, you don't get enough melatonin, and that is not going to suppress your cancer cells. So you want a high levels of melatonin. You know, I come and stay in your guest room here. I asked Angie, I said, first time I came here, can you put some, drapes so that there's no light coming in? Now you know the reason why. Because you need a lot of melatonin and you don't get enough melatonin. If there's even in a night light or any kind of gap. In fact, do you know the airplane pilots and stewardesses are told to carry clothespin? Because sometimes, close the drape and light leaks in through the crack. I carry some clothespin. Clip it, and no light comes in. This is what you want to do. Anyway, I think we have past time. Any final questions?
How do you recommend taking just a supplement of melatonin, and how much?
No, I do not recommend melatonin supplement. Get it from your pineal gland by sleeping in a dark room for say 7 hours.
I do that anyway. Okay.
Because the melatonin supplement, many of them are contaminated. They are not pure.
okay.
So you want to be careful.
Because I took it for a while and I didn't really see that much difference.
Well, if you want melatonin naturally occurring, eat kiwi fruit at supper time. Couple of kiwi fruit and some nuts. Nuts like pecan nuts and walnuts. They are all will promote more melatonin
All kinds
production.
of walnuts.
Yeah, most nuts will improve sleep pattern. All right?
Thank you.
All right, take care.
Very nice.